Save our health centre! Save our health centre!
I've been a patient at this surgery for about 5 or 6 years now, and until recently this was one of the best doctors' surgeries I've ever had the privilege to use. Since Concordia, a private company, took over the running of this surgery about 5 months ago, things have gone into meltdown. We've lost 3 doctors, we've lost a practice manager, and at this present moment in time, my understanding is that this surgery has been run by 2 locums, which is not acceptable. One of the things that absolutely disgusts me is the way in which the people who run this surgery have not communicated with the patients over the past 6 months. They've not told us what's gone wrong, they've not told us how to put things right or what they're doing to make it right, and I think it's a shame that the last people to know what's happening in their doctor's surgery are the patients themselves. And Concordia should be ashamed. I've got a meeting with Concordia this afternoon at 3 o'clock, and the Primary Care Trust who manage the contract, and I'm hoping we might get some straight answers to some straight questions about exactly what they're going to do to get full-time paid doctors working in this surgery again for the benefit of the 7,000 patients that use this surgery. I thought that patients come first, not commercial confidentiality and not profits. It's a crying shame what's happening, and I hope the demonstration today is going to show the Primary Care Trust and Concordia that we mean business and that our surgery's got to be turned around to the excellent surgery it was 6 months ago. And I'm going to use all my power and influence to make sure that things are sorted out here quickly, to make sure that the people of Broadstairs get the service that they're paying for. Thank you very much.
Recently I had a letter from the health centre asking me to see a doctor for results from the hospital. But when I tried to make an appointment, they didn't have one available. I had to wait a couple of weeks. And another time recently, a nurse gave me a prescription. She said, I'll get a doctor to sign it for you. She came back and said, I'm sorry, but there are no doctors on premises.
Suddenly, since this new company's taken over, we get different GPs every time. We don't see the same person twice. I don't care what colour they are, black, white, green, yellow, as long as we get some continuity. That's what patients need, especially long-term patients.
I had to come for a blood test. I had a letter from the clinic saying phone up for an appointment. When I phoned up to make this appointment, they said we've got nobody here to do it.
Since we've been here for the last couple of weeks, we've seen 3 different doctors, and each doctor's given us a different solution to the problem. It's just not good enough. Not good enough. And my wife's got breast cancer.
What do you want to see happen?
Concordia to lose the contract totally and give it to somebody a bit more patient care. That's the most important thing. I think this Concordia it's focused far too much, I think, on the money aspect of things.
Concordia said that they've got all their public relations wrong and that communications was a major issue and a major failure. They were also quite frank about their choice of original GPs, that for various reasons they weren't the right people at the right time, and that's why they didn't stay. But what they have said, and what actually surprised me and I feel relatively positive about, is that they are going to put things right and they're going to do it quickly. So I'm pleased about what's happened, and I think the only thing that's made it happen is the fact that about 30 Broadstairs people came out, stood there, made their views known, and the local media, including yourselves, have actually made this an issue. Had that not happened, had local people not stood up and waved placards and expressed their concerns, then Concordia would still be doing things badly, the PCT would still be abdicating its responsibilities, and the people of Broadstairs would still be getting a rubbish service. So I think it's been a really important day for learning today, that if you can get the community behind something, then the service providers, they do get quite frightened, and they do listen and they do act. So it's a good day for people power, I think, or should I say patient power.